I discussed what is stroke. Any interruption of the blood supply to the brain is stroke, which lasts for 24 hours or longer or leading to death. Then we discuss about the normal blood supply of the brain, that is the circle of Willis. Then the specific areas and some functions and the motor and sensory homunculus. Then we discuss about the worldwide prevalence. The classification of stroke divides into two, mainly ischemic and hemorrhagic. Ischemic again thrombotic and embolic, and hemorrhagic into subarachnoid and intracerebral. The common atherosclerotic plaque sites you can see at the bifurcation or the tortuous notches. It can also be classified on the basis of blood supply, that is ACA, MCA, PCA, basilar artery syndrome, and internal carotid artery syndrome. The risk factors, non-modifiable, are age, gender, race, and genetic. Modifiable: high blood pressure, blood cholesterol, diabetes, heart disease, cigarette smoking, alcohol intake, sedentary lifestyle, obesity, and stress. We have to prevent those risk factors. How to spot a stroke? The term known as B fast. B is for balance, E for blurred vision, F for deviation of the mouth, A for arms or leg weakness, S for speech difficulty, and T is if these symptoms are present, that's the time to call for ambulance and SOS basis. Then pathophysiology, then if there is interruption of the blood supply to the brain, the neurologic metabolism is altered in 30 seconds, metabolism stops in 2 minutes, and cell death occurs in 5 minutes. Then TIA are the short temporary focal loss of neurological function. Then we discuss symptoms based on the right side and the left side of the brain, symptoms discussed or based on the blood supply of the brain, then the complications, then we were on assessments, stages of recovery, investigations. So now coming to the management part, what we have to do in acute care. So first we have to check for the ABC, that is the airway, breathing, and circulation. Ensure patient airway, remove any dental dentures, perform pulse oximetry and check for the oxygen saturation, maintain adequate oxygenation, IV access, maintain blood pressure according to the guidelines, and you have to treat if systolic blood pressure is more than 220 mm of Hg or mean arterial pressure is more than 130. What you have to do in acute care? Immediate CT scan to determine the cause, whether it is an ischemic or hemorrhagic. Measures to control intracranial pressure, head and neck in alignment. This is very important. Avoid neck flexion. Elevate the head of bed to 30 degrees if no symptoms of shock or injury. Avoid hip knee flexion, and you have to do the pain management. Institute seizure precautions. Avoid any hypothermia. Anticipate thrombolytic or fibrinolytic therapy for ischemic stroke. Thrombolytic or fibrinolytic therapy with recombinant tissue plasminogen activator is used to re-establish blood flow and prevent cell death in patients of ischemic stroke. So TPA is very important. If it is given early, it is very good. Thrombolytic or fibrinolytic therapy given within 3 hours of the onset of symptom. For ischemic stroke, antiplatelets and anticoagulants should be given. Then comes the surgical management. One can go for carotid endarterectomy, remove the fatty acids from the carotid artery, and craniotomy, evacuation of hematomas resulting from hemorrhagic stroke. So after this, we will come to neuro rehabilitation. So that is a brief about stroke. Now we'll come to the main part, that is neuro rehabilitation. So neuro rehabilitation is a complex medical process which aims to aid recovery from a nervous system injury and to minimize or compensate for any functional alteration resulting from it. Neuro rehabilitation is always a teamwork. So it is a multidisciplinary approach. Here's the patient. So the patient has to be treated first with neurologist, the neurosurgeon, the nurse, the physiotherapist, the occupational therapist, speech therapist, psychologist, aquatic therapist, and nutritionist. So it is a multidisciplinary approach. Now I will explain you what is neuroplasticity. Our brain is like a river and not a rock. So it can grow, it can find its tributaries, and it can move forward. It has the potential to form new connections. So that's why we call it as a river and hence not as a rock. So the capability of the brain or the CNS to reorganize by forming new neural connections throughout the life is neuroplasticity. It allows the neurons in the brain to compensate for injury and disease and to adjust their activities in response to new situations or changes in the environment. So rehab is a process of healing from within. So there are 5 basic principles governing neuroplasticity. The first is body parts compete for brain representation. So you have to use dependent plasticity more as compared to experience dependent plasticity. There is a need for the brain to use experience to initiate a new synaptic connections between neurons. So the person has to have some experience before of that particular movement to start a new connection. The more a part is used, the bigger its area of representation, as we have already seen in the homunculus. Opposite effect is learned non-use. This is very important term, learned non-use. Second principle is the ipsilateral and the contralateral hemisphere can contribute to motor control. So if a person is having right brain injury, the left brain is also very important, as well as the right brain is also very important. So both can contribute. The damaged part also can contribute to the neural plasticity, and the contralateral part can also contribute to neuroplasticity. So if one hemisphere is damaged, the intact hemisphere may take over some of the function. To recover, the neurons needed to be stimulated through activity. So to stimulate the neurons, the person has to do repetitive activity, and hence new connections can form, and that is known as neuroplasticity. The third principle is sensory stimulation enhances plasticity. Sensory stimulation enhances the sensory representation of the body part. It makes that area in the brain hyperexcitable to plasticity. Principle number four is reduction of inhibition of enhances plasticity. So you have to reduce of inhibition. Remove factors that make the patient less motivated and sleepy. Treat post-stroke depression, but not use drugs that induce drowsiness. So reduction of inhibition will enhance plasticity. And the fifth principle is pharmacological agents can also enhance plasticity. So if we see, the first principle is body parts compete for brain representation. The ipsilateral and contralateral hemisphere can contribute to motor control. Sensory stimulation enhances plasticity. Reduction of inhibition enhances plasticity. And pharmacological agents enhance plasticity. So based on these principles, I will tell you the management. So first principle was body parts compete for brain representation. So example of this is constraint induced movement therapy. As you can see here, his left hand is affected so that he cannot use his right hand. So we have tied his right hand. So this is principle of forced use to avoid the learned non-use of the paretic side for stroke patients, mainly for training of upper extremity. Second principle, as we told, the ipsilateral and contralateral hemisphere can contribute motor control. So example of this is mirror therapy. Mirror therapy, form of motor imagery in which a mirror is used to convey visual stimuli to the brain through observation of the unaffected body part. So the contralateral, the unaffected body part, as it carries out a set of movements. In mirror therapy, the underlying principle is that movement of the affected limb can be stimulated via visual cues originating from the opposite side of the body. It enhances recovery by enlisting direct visual stimulation, showing the affected limb working properly, rather than relying on mental imagery alone. Principle 3 suggests that sensory stimulation enhances plasticity. In that sensory stimulation, you can give functional electrical stimulation, you can give various neuromuscular facilitation exercise techniques, you can stimulate all the senses. For example, first is functional electrical stimulation. This is a technique that used electric currents to activate nerves innervating extremities affected by paralysis and neurological disabilities to restore function. It is very useful for foot drop. It is very useful for hand rehabilitation. You can stimulate in the environment. You can give verbal stimulation. You can give non-verbal stimulation. You can give visual stimulation. You can give auditory stimulation. Then in this principle, there are a lot of exercise techniques also come. So one of them is neurodevelopmental techniques by Bobar. It says that it stresses exercise that tend to normalize the muscle tone and prevent excessive spasticity. Through spatial reflex inhibiting postures and movements, slow sustained stretching for spastic muscles, vibration of antagonist muscles to reduce tone through reciprocal inhibition. Other techniques such as Root's approach, it involves superficial cutaneous stimulation using stroking, brushing, tapping, and icing, or vibration to evoke voluntary muscle activation. So you give a superficial cutaneous stimulation to evoke a voluntary action. In Brainstorm approach, emphasize synergistic patterns or the synergy pattern of movement that develop during recovery from hemiplegia, what we have learned in the stages of recovery. Encourage the development of flexor and extensor synergies during early recovery, hoping that synergistic activation of muscle would, with training, transition into voluntary activation. Now comes to another facilitation techniques, that is proprioceptive neuromuscular facilitation techniques, that is the PNF techniques by Kabat. It relies on quick stretching and manual resistance of muscle activation of the limbs in functional direction, which are often spiral and diagonal patterns. And there are a lot of conventional methods also, like stretching and strengthening, attempting to retrain weak muscles through re-education. Principle 4 is reduction of inhibition enhances plasticity. So we have to treat post-stroke depression and not use the drugs that induce drowsiness. So instead of using drugs, you can use psychotherapy, that is psychological counseling for post-stroke depression. Positive reinforcement of the progress in rehab benefits all. All the above 5 principles have to be translated into functional tasks and context-oriented exercises. I have not discussed the 5th principle with the treatment because the 5th principle says medications enhances plasticity. So all these 4 principles are related to physiotherapy or related to exercise. So all these exercise has to be translated into functional tasks and context-oriented exercise. So while giving a physiotherapy to an acute stroke patient, first and foremost thing is positioning. So if the person is lying on the affected side, in this picture, the person's left side is affected. So 1 or 2 pillows for head, affected shoulder position comfortably, place unaffected legs forward like this on 1 or 2 pillows, place pillows in front or behind to give support. If the person wants to lie on the unaffected side, so the affected side again on the left side, he is lying on the right side. So 1 or 2 pillows for the head, affected arm forward and supported on pillows like this, affected leg backwards on 1 or 2 pillows and place 1 pillow behind. If the person wants to sit in bed, sitting in bed is desirable for short periods only, must be upright and well supported with pillows. Consider extra support using pillows under arms or knees. If the person is lying straight on his back, place 3 pillows in a triangle like this, supporting shoulders and head. Place affected arm on pillow. Ensure feet in a neutral position. Shoulder subluxation is a very common problem in stroke patients. Shoulder subluxation and shoulder pain. So to prevent shoulder subluxation, if from beginning only in the acute stage, if the person is taking functional electrical stimulation, these are the electrode placement in the posterior deltoid, the teres minor, infraspinatus or supraspinatus, the chances of getting shoulder subluxation greatly reduces. But if shoulder subluxation, if you want to prevent, you have to use this kind of brace. This kind of brace is not advisable because in this, the flexion synergy increases and which we don't want in stroke patients. So this is the proper brace, shoulder brace in shoulder subluxation. Now we'll quickly discuss few physiotherapy techniques. This is a technique, upper limb exercise to activate the tricep muscle, because tricep voluntary control is very important because we have to break the flexion synergy and get a tricep control. Suspension exercises for upper limb voluntary control is very useful. These are the exercises which a patient can do at home. Strategies to improve lower limb voluntary control. You can see in the bed, she is doing hip knee flexion, hip knee ankle flexion. In this, she is doing sit to stand activity and hence recruiting their lower limb muscles. Sit-ups using push-up bars for affected upper limb. Bilateral and unilateral bridging exercises are very important to regain the trunk strength to break the extension synergy of the lower limb. Quadruped exercises are very important for weight bearing exercises. So we have to weight bear on the affected side. Kneel walking exercises improves hip knee flexion pattern while walking. This is a sit to stand activity. You can give gait training inside a parallel bar. So you can see a hip knee flexion pattern is generating using a stepper. Training for ascending and descending stairs. Training for ascending and descending slopes. Upper limb training with trunk rotation. Functional reach activity with weight bearing on the affected limb. Upper extremity activity, pivot turning with weight bearing on the affected limb. These are a few occupational therapy exercises which trains for activity of daily living, which is very important to make the patients independent. The quality of life improvement is completely dependent on these activities. So here you can see grasping a bottle, pouring water from the bottle, trying to comb hair with the affected side. You can see she's trying to write. So all these functional activities are very important to improve the quality of life. Speech therapy is also very useful. There are a lot of oromotor exercises for speech. Psychology counseling, as I discussed in the principle number 4, that medication one should avoid because it does not enhance plasticity, but counseling will definitely enhance neuroplasticity. Aquatic therapy, the latest therapy, it is very useful, the water-based exercises. So after this, after so much of therapies and so much of medical management, surgical management, still in chronic stroke patients, we have seen there is some unmet medical needs. The person is still dependent on others. The quality of life doesn't improve so much what we expected. So what we can do for that? So there comes for that regenerative medicine, which is the latest technology. What is regenerative medicine? It is a process of creating living, functional tissues to repair or replace tissue or organ function lost due to age, disease, damage, or congenital defects using healthy tissue or stem cell transplantation. What are stem cells? Stem cells are defined as precursor cells that have the capacity to self-renew and to generate multiple mature cell types. So it is a precursor cells that have the capacity to multiply into any specific tissues. So if you can see this example, this is as a tree. The person is giving water to the tree and the tree grows and it gives flowers and it gives fruits. What does that indicate? So it is the unspecialized immature cells that are capable of dividing endlessly, of making exact replicas of themselves and also of swapping a range of more specialized cells. Origin of human life and stem cell. So when we were born, there was fertilized egg, then it goes to 2-cell stage, then 4-cell stage, 8-cell stage, 16-cell stage, and a blastocyst formation. And at that time, fetus form, that is a 20 weeks. So starting with a single cell, it multiplies, it differentiates into specific different cells, and finally forming the blastocyst. So different types of stem cells are seen throughout these stages. So at the early stage of human life, sperm from the father and egg from the mother form a new cell integrating their genetic material, and that is known as zygote. This is the first cell of new human life. So as I already told you, a zygote then form a 2-cell, then 4-cell, 8-cell morula, and then blastocyst. So from cluster of cells to distinguished cells. So from gastrula, it goes to 3 layers: ectoderm, mesoderm, and endoderm, and germ cells. And from ectoderm, it gives definite specific tissues. The central nervous system forms from the ectoderm. Then from the mesoderm, there are a lot of notochord, bone tissue, red blood cells, facial muscles. From endoderm, it forms the digestive or the stomach cell, the thyroid cell. So it differentiates into specialized cells. So stem cells have the ability to repair, replace, and regenerate. How do they do that? Long-term self-renewal, that is, one parent yields 2 daughter cells identical to the parent throughout the life. So parent stem cell, and these are the daughter stem cells. So as you can see, a parent stem cell, stem cells can be differentiated into a muscle cell. It can be differentiated to a blood cell, a nerve cell, a heart cell, or cartilage cell, or a fat cell. So it has a lot of potential to differentiate to any kind of specialized cells. Stem cells are unspecialized cells that have the following unique properties: robust repopulation of target tissue. It has a paracrine effect. Transplanted cell secretome through paracrine signaling induces changes in nearby cells, altering the behavior of those cells and cellular microenvironment that leads to neuroprotection, immune modulation, reduced inflammation, and new blood cell formations. What is the mechanism of action? Direct replacement of damaged cells. There is neurogenesis, there is neuroprotection, there is increased cell survival, there is new angiogenesis, improved synapse formation, immunomodulation, and decreased glial scarring. So classification of stem cells first is based on potency. So there are totipotent cells, there are pluripotent cells, there are multipotent cells, and there are unipotent cells. Totipotent cells can differentiate into 3 germ layer cells. Pluripotent can differentiate into 3 germ layer and not placenta. Multipotent cells with ability to differentiate into a closely related family of all types of cells. Unipotent ability to only produce cells of their own type but have the property of self-renewal. So based on the stem cell transplantation, one is autologous and one is allogenic. You can see stem cell is collected from the same person, it's being processed, and then again it reinfused on the same person. While in allogenic, it collects from one person, it processes, but it gets injected into another person, that is allogenic. It is minimally manipulated cells. More than minimally manipulated cells, the genetic alterations altered cell function. So the less manipulation is much more better than high manipulations. There are 4 types of stem cells available at present. There are embryonic stem cells, there are adult stem cells, there are umbilical cord stem cells, and there are induced pluripotent stem cells. There are a lot of routes of administration. You can give it intrathecally, you can give subcutaneous, intravenous, intracerebral, intranasal, intracoronary, intramuscular, intraarterial, and intraarticular. But we in Neurogen uses intrathecal route of administration, and in muscular dystrophies cases we give intramuscular also. But how does neuro rehabilitation complement stem cell therapy? Or in other terms, after stem cell therapy, why neuro rehabilitation is so important? So here comes the picture. The cell transplantation, the tissue transplantation, the paracrine mechanisms, the tissue replacements, these all are stem cell therapy's properties. External stimulation, exercise, assistive technology, nutrition, psychosocial rehabilitation, these all are therapeutic properties. When the regenerative medicine combines with rehabilitation, so this is regenerative medicine is combining with rehabilitation, there is neurogenesis and neuroprotection. So there are 2 things happening, which is known as neurogenesis and neuroprotection, and it enhances tissue function, it reduces the disability, and it improves the quality of life. Function of new brain tissue, that is the neurogenesis, process by which neural precursor stem cells produce neurons. So this is one neural precursor stem cell which is producing a brain cell, that is known as neurogenesis. So it can be an embryonic genesis which happens in the mother's womb as the fetus grows, and it can be adult neurogenesis from birth to adulthood and further when a child develops. I will give you a short example. When in Mumbai, the local trains start, that is at the birth of the Mumbai railways, there were only 3 stations. The train used to start from Boribandar and ends to Thane, and it has a junction in Sion. So it has a one-way synapse, and that happens to ourselves when we are at birth. Only one-way connection. But as we grow, as we grow and as we learn a lot of tasks with our experiences, you can see this is the present scenario of the channel of the Mumbai local railway network now. It has a lot of tributaries, it has expanded a lot. So this is how you grow, how a person or how a human being grows. So at birth, there are only few connections or a single connection. Then with experiences, with repetition, with learning, he can develop complex connections. And hence, this also terms, we can tell it as a neural plasticity. Why has this network grown? there was need, more number of commuters, more area to be covered, more routes to be developed. How were the new routes decided? Most frequently traveled routes. So the more amount of repetition you do, the new routes develops. So that is most frequently traveled routes. So this is neuro regeneration, that is the stem cell, and this is neuro rehabilitation. So if a stem cell goes inside, it has the potential to multiply with rehabilitation. Alone, neuro regeneration cannot happen. That is, without rehabilitation, neuro regeneration cannot happen. So neuro rehabilitation means repetitive activities of a specific task can learn new things, can form new connections, and you can see the network has so much improved. Why has this network grown? So it forms the new network connections. How is this network grow? One is activity independent and one is activity dependent. Activity independent means it will grow irrespective of any activity, and that happens in stem cell, that is differentiation, migration, and axon guidance. This is the property of stem cells. The stem cell will grow. It does not require activity, but what is required is activity dependent. When you do an activity, the new synapses, the new synaptic plasticity develops. So you are having the raw material, but to use that raw material, you have to do a lot of activity or repetition of tasks or rehabilitation. So you have the raw material, you have the workforce, just need for repair. So there are a lot of articles based on neurogenesis and exercise, past and future directions, that exercise improves mood and cognition. Physical activity also causes a robust increase in neurogenesis in the dennate gyrus of the hippocampus, a brain area important for learning and memory. One more article which tells that physical exercise induced adult neurogenesis, a good strategy to prevent cognitive decline in neurodegenerative diseases. This article concludes that exact links between physical exercise, increased adult hippocampal neurogenesis, and improved cognition are still unclear due to current technical limitation. It is undisputable that exercise has a positive impact in the brain, both during aging and neurodegenerative processes that are associated with poor cognitive function, including dementia. Physical exercise induces hippocampal neurogenesis and prevents cognitive decline. Neuroinflammation negatively affects adult hippocampal neurogenesis and cognition. Exercise compensates. How can we ensure that these cells behave in the intended manner and result in the functional tissue recovery after transplantation? So there are two factors affecting the neurorehabilitation, growth and repair. The exercise and nutrition and the neuroinflammation and the stress. So the more you exercise and more nutrition you give, the neuroinflammation and stress will reduce. So it is vice versa. The more you exercise, the more repair. And why the repair will occur? Because the neuroinflammation will go down. So neuroinflammation is regenerative medicine. Psychological stress is dealt with psychological rehabilitation. Exercise we deal with physiotherapy, occupational therapy, and speech therapy. Nutrition to diet and nutrition advice. So basically, stem cell therapy is a teamwork. So stem cell therapy always joins hands with neuro rehabilitation. So now this picture I think makes more sense. The cell transplantation, the tissue transplantation, the paracrine mechanisms, the tissue replacement. This is properties of regenerative medicine. These are the properties of rehabilitation. When both combines, as I told, there is neurogenesis and neuroprotection, and hence there is enhanced tissue function, reduced disability, and improved quality of life. So now I will tell you what is regenerative rehabilitation. So now we have combined these two things, regenerative medicine and rehabilitation. So regenerative rehabilitation integrates regenerative technologies with rehabilitation clinical practices to restitute function and quality of life in individuals with disabilities due to otherwise irreparable tissues or organs damaged by disease or trauma. So there are a few articles which is telling that human hippocampal neurogenesis drops sharply in children to undetectable levels in adults. Benefits of exercise in adults. There is neuroprotection, which gives secretion of neurotrophic factors, improve blood supply to the brain, and enhance neural plasticity. So these are the benefits of exercise. It secretes neurotrophic factors, it improves the blood supply to the brain, and it enhances the neural plasticity. There are articles related to that, beneficial effects of physical exercise on neuroplasticity and cognition. Voluntary exercise induces a BDNF-mediated mechanism that promotes neuroplasticity. So for exercise, what is your rule of thumb? The rule of thumb is exercise you should do 6 hours a day, 6 days a week for 6 months. So after stem cell, we prescribe exercise prescription as 6 hours a day, 6 days a week for 6 months. So this much amount of vigorous rehabilitation is necessary to get the stem cell working. So Neurogeneration Rehabilitative Therapy at Neurogen Brain and Spine Institute. So what we do here is, we do here autologous bone marrow mononuclear cell intrathecal in transplantation with rigorous multidisciplinary rehabilitation. So we have a case study, autologous bone marrow mononuclear cells intrathecal transplantation in chronic stroke patients. So the results of our study showed that after stem cell therapy and after vigorous rehabilitation, we have total 24 patients, and in that, out of 24 patients, 12 patients showed improvement in walking, that is ambulation, 10 patients showed improvement in hand function, 6 patients showed improvement in standing balance, 9 patients showed improvement in walking balance, and 9 patients also showed improvement in FIM, that is functional independent measure, and that depends on your quality of life. So what we have found is there is a statistical significant difference seen in FIM scores before and after stem cell therapy. You can see the FIM score pre was 73.67, the mean score, and post it is 78.17, which is statistically significant. Now comes to the PET scan. When we do stem cell therapy, before stem cell therapy, we do a scan known as PET scan of the brain, PET CT of the brain. It tells the brain metabolism, that which area is functioning, whether the area is functioning appropriately or not, whether the area is functioning less or more or normal. So wherever there is green color, that signifies the tissue is normal in that area. Wherever there is blue, it suggests hypometabolism, or there is reduced metabolism in that specific area of the brain. And when there is red, it suggests that it is hyperactive. So green is normal, blue is hypometabolism or hypoactive, red is hyperactive or hypermetabolism. So green is good, blue and red are not good. So in this particular patient, PET CT scan of the brain done before stem cell therapy, and it shows quite a large blue areas. But when we compare this patient after 6 months of stem cell therapy and vigorous rehabilitation, we found a lot of blue areas are getting converted into light blue or green areas, which suggests that the metabolism in these areas are becoming normal. So if the function is becoming normal, definitely there are going to be improvement in the symptoms. If you see these PET CT scan of stroke patients, there are 3 different patients. This is pre, this is post. You can clearly see in the blue patch over here, which is hypometabolism, and here you can see the green patch. So this is after stem cell therapy and vigorous rehabilitation. So I'm telling neuro regeneration is possible with rehabilitation. So here you can see there is a lot of blue areas which is now converted into green after 6 months. Here also you can see a lot of hypometabolic areas which are converted into green or little more or less hypometabolic areas. So Neurogen has published 5 scientific articles on cell therapy in stroke. So I will show you some of the improvement videos. This is a 42 years old stroke patient. This is the improvement after 6 months. You can see the pattern of walking has changed a lot with the AFO. You can see the upper limb activity. It was difficult before, but now you can see the bimanual activity of both the hands together. She's doing it very well. You can see the standing and the walking balance. Here she is supported with the therapist, but here she is quite independent. You can see the bed mobility activities, the rolling activity. She was completely dependent before, but after 6 months, she is completely independent. Now she is getting up on her own from bed, from supine lying positions. She is doing cycling at home. So lower limb activity has also improved significantly in this patient. You can see she can grasp a bottle. So hand function, as I told, according to the motor homunculus. Her speech has improved a lot. Her pronunciation has improved. So as you can see, in the motor homunculus, the hand part is very big, is very large, and hence the recovery is also little slow. But with stem cell and with rehabilitation, we can regain the hand function. This is another patient of stroke, 50 years old. This is also improvement after 6 months. Improved trunk strength. Knee walking has improved a lot. Sit to stand from lower level and without support. Reduce circumduction gait. Foot is clearing more easily as compared to before. This is 24 years old stroke, young stroke patient. His muscle tone, the spasticity has reduced a lot. Upper limb gross motor activity has improved. He can pick the pegs from the pegboard, and he can also release it. Release is also very difficult in a lot of patients, but with this, with stem cell therapy and rehabilitation, we have achieved that. So he can do hand to mouth activity. He can hold the bottle. His standing balance, one leg standing has improved. Weight bearing has improved. His gait has improved significantly. Circumduction has completely almost reduced. He can now jog. He can now run. He can climb stairs without any handrail support. He can descend stairs like a normal individual. So these are some of the improvement videos. So what we do in Neurogen is multidisciplinary approach. So we have a pediatric physiotherapy unit. We have an adult physiotherapy unit. We have pediatric occupational therapy unit. We have adult occupational therapy unit. We have speech therapy unit. We have psychological interventions unit, special education, and diet and nutrition. Special facilities in our hospital. We have a special walking track specially made for spinal cord injury patients. Aquatic therapy. We have ACDC. We have sensory integration room. We have specific hand rehabilitation. So thank you very much for your patience. Now I am open for any questions. So if you have any questions, I'm ready to answer all your questions. Okay, so the question is, what is the window period for recovery of stroke? So it completely depends on the area of the lesion. It completely depends the amount of injury, and whether it is ischemic stroke, whether it is hemorrhagic stroke. All different types of stroke has different recovery period. And it has stages, as I said. It has flaccidity stage, it has spastic stage, and then it goes to recovery stage. So there is no specific window period for recovery after stroke. It can be a transient ischemic attack or it can be a chronic stroke, but it completely depends on area of the lesion. But as we have seen that with rehabilitation, the recovery is faster, and with stem cells and rehabilitation, the recovery is more faster. Thank you. I'm getting one more question from Mari Muthu. Uh, how far the neurogenesis treatment is affected in MCA? Okay, very good question. In MCA stroke, as I told you already, that mostly it affects your upper extremity and face area. So upper extremity, as I told, in the motor homunculus, the hand area is large representative area in the brain. So it takes some time, but as compared to conventional rehabilitation with stem cell and with neurogenesis, it enhances or it speeds up the recovery time. And in some cases, we have seen with only with rehabilitation, we have not achieved in hand rehabilitation. We have not achieved anything in hand. But as we see, there is very good improvements in, especially in the hand part after stem cell therapy. Thank you. Getting a question from Ravindra Pratap Singh. Yes, you can send reports to me to the Neurogen BSI website, and then our coordinators will call you. Okay, I'm getting one more question. What are some of the food that could make stroke patient worse? Okay, so as you know that, as I told about the risk factors, the food consisting of high salt, which will cause hypertension. So you have to reduce on salt. Then fatty things, like if there is high cholesterol, then there are higher chances of getting a stroke. As I told in the risk factors, the fat deposition in the arteries causes stroke. So we have to reduce the fat amount. Then you have to reduce also groundnuts. Groundnut is also a risk factor in the stroke cases. And so these are the things which you should avoid: the fatty things, and the salty. Yeah. So I'm getting another question. Is stroke recovery linked to a person number of years of living the stroke and the person's age? Yes, it matters a lot. If a patient comes to us in mid stage, that is after 3 months or 4 months of stroke, the recovery is much more faster. If a person comes with lot of contractures already developed, with lot of deformities, with lot of dystrophy, so it takes time in those chronic cases. But definitely the improvement can happen, but the speed of recovery will definitely slow down if a person comes in a chronic stage as compared to an acute stage. Okay, I'm getting one more question. He says, why the upper limb and the hand rehabilitation is delayed? Okay, as I already told you, our body's representation in the brain, which is known as motor homunculus. So in that, our body schema in the brain represents that our hand area is the largest area, because we use our hand in day-to-day activities mostly. So the area of representation is in the brain is much larger as compared to the leg area. So therefore, if the area representation is larger, so the amount of time taken for recovery will also be higher. So that is the reason why it takes long time. If patient is having a stroke since 14 years, Yes, stem cell will happen, but as I will definitely improve. Your patient will improve, but the only problem, as I told, the recovery will be little slower as it as chronic. Now it must have developed lot of contractures, lot of deformities, so it might be delayed, but like recovery is possible. Yeah, is your department able to collaborate and support Ghanaian stroke survivors? Yes, definitely. We will try to associate with you, and we will reach to you through internet. Thank you. Okay, I think it's done. Thank you very much.